Good evening, everybody. Hi, this is Dr. Gayatri, Professor Department of ENT. Today in this video, I shall be discussing about an interesting topic, that is the visual field defect in temporal lobe abscess. One of the classical focal neurological deficits in temporal lobe abscess is the pie in the sky appearance or contralateral superior quadrant anopia. That is, a patient with right temporal lobe abscess will be blind for the left upper quadrant of the visual field. Let's now see the pathophysiology behind the development of this defect. The optic nerve is formed by the convergence of the axons of the ganglionic cell layer in the retina. The human eyeball has a biconvex lens which is thick in the middle and thin in the periphery. This lens focuses all the light rays falling on it, creating a real inverted image of the object of interest on the fovea of the retina. When I say inverted, the image on the retina is upside down when compared to the object, and at the same time the image of the left hemifield falls on the right side of both retinae and that of right hemifield falls on the left side of both retinae. To explain it further, retina is divided into nasal retina and temporal retina. The nasal retina are closer to the nose and hence to the opposite eye, whereas the temporal retina fall on the side of the eyeball. The image of the left hemifield falls on the left nasal and right temporal retina. This orientation of the nerve fibers on the retina is retained even within the optic nerve. So as you can see in this particular image, the image of the upper part of the object is formed on the lower part of the retina, whereas that of the lower part of the object is formed on the upper part of retina. Not just that, the image of the left side of the object is formed on the right side of the retina, and the image of the right side of the object is formed on the left side of the retina. For example, the red colored field shaded here corresponds to the left upper field of the visual field. The image of this part of the object is formed on the right lower aspect of the retina. Right? So continuing further along the optic pathway, the orientation is retained even in the optic nerve, similar to that in the retina. The two optic nerves meet each other at the level of the optic chiasma where the fibers decussate. The temporal fibers of the optic nerve continue in their respective optic tracts, whereas the nasal fibers of the optic nerve cross over and join the opposite side. What is the implication of this? We can see that the left temporal and the right nasal, both these fibers are going to be conveying information from the right hemifield. So the left optic tract is going to be having information which came from the left side of the retinae or the right hemifield. So the optic tracts give information to us about the contralateral visual fields. The optic tracts on each side, these are the two optic tracts. The optic tracts on each side, they relay in the lateral geniculate bodies within the thalamus on the corresponding side. The axons from the neurons of this lateral geniculate body are projected as optic radiation to the visual cortex, which is located in the occipital lobe of the brain. The optic radiation is divided into two parts. We have the upper optic radiation and the lower optic radiation. As you can see in this image, the fibers of the upper optic radiation, they directly travel from the lateral geniculate body through the parietal lobe into the occipital lobe and visual cortex, whereas the fibers from the inferior optic radiation form what is called as the Mayer's loop, which loops around the temporal lobe before reaching the visual cortex. It is the fibers of this Mayer's loop which are affected in temporal lobe abscess because of the proximity of the Mayer's loop to the temporal lobe. Imagine a patient with right temporal lobe abscess. His right Mayer's loop would not function. Just like how we explained regarding the information carried by the optic nerve and the optic tract, I would like to first explain regarding the information carried by the upper optic radiation and the lower optic radiation. The upper optic radiation carries the information relayed from the ipsilateral upper part of the retina, whereas the lower optic radiation conveys the information from the ipsilateral lower aspect of the retinal field. So this lower optic radiation is the one that is affected in case of temporal lobe abscess. So what is happening here? It is this red color retinal field that's going to be getting compromised. So the patient will not be able to see this red part of the object, which actually falls on the left upper quadrant of the object. Hence, this is the explanation behind the development of the classical contralateral superior quadrantenopia in patients with temporal lobe abscess. Thank you.